Alzheimer's disease is a progressive disease of the human brain that is characterized by impairment of memory and a disturbance in at least one other thinking function. This disease is a form of dementia, which is a medical condition that affects the brain. When we hear Alzheimer's disease, we automatically think of older people because this disease most likely occurs in people over the age of 65. Statistics show that 1 in 8 people will have Alzheimer's disease after they reach 65 years old. The month of November is Alzheimer's Disease Awareness Month. Because of this reason, I will inform you on Alzheimer's disease. There are 10 signs and symptoms to this disease. One of the most common signs of having Alzheimer's disease is memory loss, especially the recently learned memory. The second symptom is having challenges in solving or planning problems. The third sign or symptom is having problems completing familiar tasks that you usually complete on a day-to-day basis. The fourth sign is confusion in a time or place. The fifth one is having trouble understanding visual images. The sixth sign is having problems with words in speaking or writing them. The seventh symptom is misplacing things and losing the ability to retrace your steps to find them. The eighth one is poor judgment. The ninth is withdrawal from work or social activity. And the last one results changes in your mood and behavior. Now that we are aware of all the signs and symptoms, let's learn more about the causes of Alzheimer's disease. Scientists believe that for most people, Alzheimer's disease results from a combination of genetic, lifestyle, and environmental factors that affect the brain over time. The first cause to this disease is genetics. The more research that is done, the more researchers learn that genes play an important role in its development. Early onset Alzheimer's is a rare form of disease. It occurs in people ages 30 to 60 and represents less than 5 people who have Alzheimer's disease. Most cases of early onset Alzheimer's run in the family. It is caused by changes in one of the 3 known genes inherited from a parent. Most people with Alzheimer's disease have late onset Alzheimer's, which usually develop after the age of 60. Most experts believe that additional genes may influence the development of late onset Alzheimer's. The second cause to this awful disease is the environmental lifestyle factor. Research also suggests that a host of factors beyond the basic genetics play an important role in the development and course of its Alzheimer's disease. There is a great deal of interest in associations between cognitive decline in vascular and metabolic conditions such as heart disease, stroke, high blood pressure, diabetes, and obesity. Understanding these relationships and testing them in clinical trials will help us understand whether reducing risk factors for these conditions may help with Alzheimer's as well. Now that we have learned about the signs and symptoms and causes of Alzheimer's disease, we can now talk about the ways to treat this disease. What treatment and medication options are available for this disease? Currently, there are no cures for Alzheimer's disease. Researchers are looking for new treatments to alter the course of the disease and to improve the quality of life for people with dementia and one day hope to find a cure. Even though there is no cure for this awful disease, there are medications to help with memory loss. The U.S. Food and Drug Administration has approved 2 types of medications. As Alzheimer's progresses, brain cells die and connections among cells are lost, with cognitive symptoms to worsen. While current medications cannot stop the damage Alzheimer's caused to the brain, they can help lessen or stabilize symptoms for a limited time. Some doctors also prescribe a high dosage of vitamin E for cognitive changes for Alzheimer's disease. Although current Alzheimer's treatments cannot stop Alzheimer's from progressing, they can temporarily slow the worsening of dementia symptoms and help improve the quality of life for those with Alzheimer's and their caregivers. Today, there is a worldwide effort underway to find better ways to treat the disease. delay its onset, and prevent it from developing. Alzheimer's is an intimidating and threatening disease. It is a common type of dementia that worsens over time. There are no current cures for this horrible disease, but treatments and symptoms are available, and researchers are still looking for a cure.